Hi, this is Jay Gosuico with Sierra Tahoe Ski Patrol and RodSavage.com. In this episode, your blood pressures. Now that you're a medic, you know that you have two different types of blood pressures. One is your arms and legs. That's the blood pressure your doctor at the doctor's clinic or office has, or if you go to a drugstore, you'll sit in one of those automated machines and get a blood pressure taken of your arm, which is the normal blood pressure that everybody thinks about. The other blood pressure is the blood pressure of your lungs, which operates at a very much lower blood pressure than your arms and legs. Your arms and legs, the systolic, probably going to be about 150 on your normal patient, right? You want that between 90 and 150 on your normal patient, and between 60 to 90 on your diastolic. So your systolic, SBP, is 90 to 150, and your diastolic is 60 to 90. This is your DBP. Mostly concerned in your medic about your SBP. But once you get to the hospital, I'll be worried about his lung blood pressure, his pulmonary system. I would call this a pulmonary hypertension if he had high blood pressures of his lungs. So where that's key in your assessment skills is a high blood pressure in the lungs, a high pulmonary blood pressure will get you closer to your HAPE, your high altitude pulmonary edema, and some of your more older and or sicker patients, especially the ones with a cardiac or pulmonary disorder, might have just the regular pulmonary edema. All right, not to be confused with a pulmonary embolus. Pulmonary edema is you've got such high blood pressure here happening that there's actually blood going into the lung cavity itself, into the lungs themselves, and therefore you're coughing up pink frothy stuff. That's the blood pressure that's pressing into your lungs. So the pink frothy stuff is blood coming from your heart because of the high blood pressure. Normal blood pressure is going to be 15 to 30. That's a systolic of 15 to 30 and a diastolic of 4 to 12. That's the blood pressure, the systolic blood pressure of your pulmonary artery, your PA, and your diastolic blood pressure of your PA. Your pulmonary vein can be anywhere between 2 and 15. It doesn't have a systolic and diastolic because it runs so smoothly and so low after the blood gets from the PA to the lungs and comes back through the pulmonary vein. So there you go, pulmonary vein. The next couple of seconds, a little bit depressing, but Princess Diana died from a pulmonary vein tear in her car. If she was in the U.S., she would have been assessed into the emergency room, seen on a chest x-ray, verified on a chest CT that she had a pulmonary vein tear, and she would have gone immediately to the OR and would have been out of the OR in the recovery room, probably starting to eat or drink in the recovery room in the time that it took her to die in her car. What happened was she had a small little tear in her pulmonary vein, and it kept bleeding out. When the medics arrived on scene, a very inexperienced medic saw someone who was alive and kind of sat and watched symptoms. Their emergency system is a little different than ours. I think theirs is improving now. But she could have been saved, and had she been in the U.S., she certainly would have recovered from her injury of that car crash. So sorry to hear that bad news, but I want to turn that bad news into good news. when you find a patient that's got that kind of system going, keep this in the back of your mind, and it's a scoop and go. All right? So pick up your patients and rescue them. Your blood pressures. This is Jay Gosuico with Sierra Tahoe Ski Patrol and RobSavage.com. Wear the vest, be the best. Shaka.